So thank you everyone for joining us on this edition of Welbodi. Today we'll be discussing fetal alcohol syndrome. Sounds strange, I know. Now this may sound strange to a lot of our listeners and our viewers, but it is a condition in a child that results from alcohol exposure during the mother's pregnancy. But I guess we'll explain all of these and more. She is Dr. Marylin Mabell Wilson, a neurodevelopmental pediatrician, a medical director, and CEO of Mission Pediatrics Accra, Ghana. Thank you, Dr. Marylin, for joining us, and it's good to see you again.
Thank you for having me. Good to see you too, Emo.
Indeed, let's start with the basic question. While researching on this topic, it sounded strange because we may have heard of all the conditions, illnesses, and all of that, but this particular one sounds very rare. So please, doctor, tell
Yeah.
us, what is fetal alcohol syndrome?
Okay. So even before I go through it, indeed, it's one of the conditions that is preventable. So usually in my line of work, a
Mm,
lot of the conditions you don't have control over. But fetal alcohol syndrome or fetal alcohol spectrum disorders, which I'll talk about, is one of the commonest preventable neurodevelopmental conditions. So, as he said, rightly so, it is a condition or a group of conditions because it can vary that occur in children and eventually in adults because it's a lifelong condition, occurs because of alcohol exposure in the womb whilst the mother is pregnant. So as he said, fetal alcohol syndrome is the sort of the severest end of the spectrum. That's
okay.
like the worst form you could have. But under that umbrella, we say fetal alcohol spectrum disorders. And it's a range from the FAS, which is the fetal alcohol syndrome, to some mild forms, which will still have challenges, but not as severe as the FAS.
Mm.
And so, okay,
Oh, please
so
go
that
ahead.
is
Please go ahead.
FAS. Okay,
Mm,
okay. It presents as a range of conditions or range of challenges in the child. This could range from a difference in the way their face looks. So we call it syndromic fascies. So typically they would have a small head. They may have small eyes. So the length of your eye, the two
mm,
eyes, theirs
mm,
will be smaller than usual.
mm.
They may have what we call a smooth philtrum. So a smooth philtrum is the top of your upper lip here.
Okay.
There's a groove there, like
Yes.
a shallow
Yes.
gutter.
Yeah.
They will have one that is smooth. It's almost flat. You wouldn't see the gutter.
Mm,
The upper lip is usually thinner than usual and a few other things. That is typical. So you would see that on the face. That's this. If you know FAS, you would see that this is FAS.
mm.
Then apart from that, alcohol can affect every aspect of the fetus or the baby that is growing in the womb. So it can affect the brain, the heart, the kidneys, everything. It can even affect the limbs and everything. So you can imagine that the range and the features we see are so varied. Apart from the facial features, you would
Mm.
have a child who is not growing well. So they have restricted growth. So they are not growing as tall as their mates. They are not growing as fast as their mates. So they have difficulty and controlling their emotions, difficult behaviors, you can
Mm.
name it, all aspects, it will cover it.
But how
So in a short,
prevalent, yeah, how
yeah,
prevalent is this condition? I mean, if you look at it, in
yeah,
my intro, I mentioned that it sounded strange.
yeah,
I bet you a lot of people, I know those in the medical field may know about this, but the regular people on the street, the regular, citizen, may not really know what this is. How prevalent is this condition? Is it something we see and we actually can't recognize?
Yeah. So actually, I must say that in our part of the world, which is Africa
Mm,
and including sub-Saharan
yeah.
Africa, we haven't done a lot of prevalence studies. A lot of the research has been done in South Africa. And in South Africa, let me compare. So globally, you would have a prevalence about 8 in 1,000 individuals having fetal alcohol spectrum disorder, which is the broad aspect. And you would have about 2 in 1,000 having FAS, which is the severe form of the condition. In Africa, most of the studies have been in South Africa. And South Africa has one of the highest rates of fetal alcohol syndrome. So comparatively, South Africa has up to 110 or 11 in 1,000 of
That's
the
that's a whole lot.
yes, of the broad spectrum,
Mm,
whilst they have 14 in 1,000 of the severe form compared to the 1.5 globally. But that is just because they have been doing the studies.
mm,
But what we usually would do is to estimate. If you know the countries that drink a lot of alcohol per capita, then automatically you know that FAS is going to be more there. So in Africa, we do drink a lot, a lot.
you do.
I know. So I mean, we have quite a number of African countries in the top 10 countries in the world who drink a lot.
Mm,
So even though we haven't done the research, I can tell you that we do have a lot
mm. Well,
in the system. Yeah.
in this case, let me ask now, how much alcohol is dangerous?
Okay, that's a very good question. So in all the science up to now, there is no amount that is safe
Mm,
in pregnancy. So any amount can be dangerous. And in all the research, nobody has been able to tell us that if you drink maybe 1 glass
mm,
every week, it's going to be dangerous. Any amount can be dangerous. What we do know is that those who binge drink, so they don't drink for a while, then they drink maybe one weekend they drink a lot, or those who are actually
to make up
addicted
for
to
those
alcohol.
weekends or days that they didn't drink.
Yes, yes, yes. And then those who are addicted to alcohol, who have to have alcohol all the time, these
Mm,
two groups are more likely to have effects when they have children, but it can cut across. The other thing is that if the alcohol exposure is early on in pregnancy,
mm,
that is also more likely. Having said that, it is standstill that no amount is safe and nobody knows the level that is safe. So it's better not to drink at all if you know you're going to get pregnant or if you're pregnant.
mm. Well,
Yeah.
is the case always that of the mother, I mean, in terms of the exposure to alcohol? What about the fathers in this
Yeah.
case? Do they have a role to play
Yeah,
or contribute to this syndrome?
definitely. The fathers have a role to play. So research is showing us that men who drink a lot have abnormalities in the sperm. So
Mm,
the quality of the sperm, the quantity of it, and even the genetic makeup of the sperm plus the man itself is all changed with alcohol. And so we are finding in research that yes, there's a contributory factor. So before we go on, you see about 1 in 13 women who drink will have a child with FAS, and we don't know who the 1 in 13 will be. So that tells us that it's not only the woman's exposure, but there are other multiple factors that come to play to have a child with FAS or FAST.
mm,
And so some of those factors includes the paternal contribution. So genes are, the coding for the human body.
yeah.
And even with addiction, we are getting to know that even the genes you have can push you towards drinking or push you away from drinking. So that paternal contribution, if the father is drinking a lot, has that addiction, it always affects the genes they pass on to the child. And the other factors, as I talked about, would be how early you are drinking as a mother, and then maternal nutrition. So if the mother is not well nourished, that can push you up to have a child with FAS if you are drinking at that time. So yes, paternal and contribution is very important.
Well, how do you now detect this condition early? Because I'm sure an early detection can somewhat bring a solution.
Definitely. So let me say that about 4 categories we look at when we are looking at the features to diagnose FAS. So I talked about the facial features. The second is the growth. So this child is born very small compared to other babies and is not putting on weight. Then this child has all the different developmental conditions affecting their movement, motor, their balance, their fine motor, which is their hand movements, their learning and everything. Plus the fact that we know the mother was drinking. So if any child has any of these risk factors, then as they are going to see their doctor, the doctor should be looking out for any of these features to see if it is there. And I must say that we in the health profession, we haven't done too well. It's not, we don't go out of our way to actually look for it, but it's, as you brought it up, it's really good for us to look for it, because if they are caught early intervention really is helpful. And I'm sure we are going to talk about the things we could do for them. And it really helps if you catch them early.
Well, there's also concern about the treatment after being maybe detected early. Are there treatment for this at all?
Yes, so there is no cure, as in there's no medical medicine we can give them, but we have these different therapies. So, for example, I said that exposure to alcohol could affect the development of organs. So one very common one is heart conditions in these children. And so if they have heart abnormalities and you detect this early, it helps them to grow better. So if it is a hole in the heart and then we are able to fix that hole, then they can grow better, they even grow bigger, and then their development is better. So you see that. But the other therapies is supportive. So if the child has communication problems, they are not speaking well, they are delayed, then you start them on speech therapy, which will improve their communication. If they are not walking well, on physiotherapy. If they need a kidney transplant or they need some surgeries for their kidneys, you do that for them. So the different treatments will include, apart from the surgical ones, things like physio, occupational therapy, speech therapy, psychiatry, psychologists, and behavior therapy, because they do have a lot of behaviors. They tend to be very strong-willed, stubborn, not listening, things like that. Yeah.
Well, when you mention FAS or fetal alcohol syndrome, what comes to the layman's mind is Down syndrome. So what is the difference between this and Down syndrome?
Okay, so the big difference is that Down syndrome is a genetic developmental condition that affects chromosome 21. So we know what it is. We don't have control over who has Down syndrome. Fetal alcohol syndrome is these varied conditions I've talked about that occur if you drink alcohol during pregnancy. The way they look is different. They may have some common developmental challenges like the speaking, the learning, attention, but where it's coming from is totally different. One is preventable, one is you have no control over it.
So what now happens to a child born with this condition?
Yeah. So if unfortunately this child has come into the world with this condition, the best thing is to give them the supports as I have talked about early. First of all, we need to catch them early. The other thing is that you can imagine that if a mom has been drinking to be able to have FAS, most of the time the social setting around the whole family may be dysfunctional. So you can imagine that.
Yeah.
A lot of the time we see that there's financial issues, there's dysfunction in the home, the parents may not have a stable job, there may be abuse, they may be abusing other things apart from alcohol. So such a child needs a holistic, treatment, a holistic management, looking at all these aspects. Because if you fix the heart, you give them speech therapy, but they go back home and education is not proper, or dad is beating mommy, they can have all sorts of other, neurological and mental health issues. So you usually have to treat this child as a whole. In certain places where the home is not stable for the child, the social welfare will actually take this child away to maybe a relative that has a more stable home, whilst we try and support the child with all these other therapies I've talked about.
Well, just to be clear, so this set of children can actually be classified as those with special needs, right?
Definitely.
So
they
which
can be
means,
classified.
yeah, so which means they equally will be treated like, children with Down syndrome.
Yes, yes. But remember that special needs is such a broad phrase, or a broad term, is that in that even though they are also special needs, their needs may be different from a child with Down syndrome. Their needs may be totally different. But yes, they are special needs because they need more help to be like their age mates, and they need more help to get to the developments like their age mates. So they are special needs.
Have there been instances or experiences where you have treated or worked on a child of this nature? If there is, can you share any with us?
Oh, yes, yes. I have seen a number of children with fetal alcohol syndrome, both in Ghana and elsewhere.
Yeah.
And usually it starts with, first of all, us giving the parents this diagnosis that this is FAS. So you can imagine it brings a lot of couple, yes, challenges and clashes. And once they have accepted it, it comes in with all sorts of things. So it takes about $1 million to be able to support a child.
I mean, it's enough for one to laugh. 1 million.
Yes. They have done that kind of research that it takes $1 million to support a child who has FAS from their, because a lot of the times they have these, the brain has been affected. They have all these attention issues. So I've seen a child who has FAS, and we realize that the mother also has FAS. And because the mother has FAS, she could not, amount to much. She couldn't get a good job with all the stresses in life. She turned to drinking and then also had a child with FAS. So it gets really murky. It can be generational. You can have a grandfather, father, and child all having the same condition.
Maybe the amount they mentioned now, $1 million. That's a whole lot. That alone can set up a local government somewhere in sub-Saharan Africa. So you can now imagine parents who have children with these conditions. They will obviously not want to come out to speak up on this, and as such they may become let me say useless in society. But just before we go, doctor, what are some of those physical features again? I know you had mentioned this earlier, but I would like you to take your time and explain the features of a child with this condition.
Okay. So first of all, we look at the face. So the face, the head itself may be smaller. smaller than you expect for age. And we have certain sizes for each head according to the age. So the head may be small, which tells you that the brain is not growing properly. Then on the face, they have small eyes. So let me take my glasses off and show you. From here to here, there's a range in the length that is supposed to be for babies according as they grow. They have smaller or a shorter length of the eye. Then they have a short nose. Then their philthum, which is the gutter on the upper lip, is very shallow or it's not there at all. And then the upper lip is very thin. You can see it's like, thin compared to what and also compared to the lower lip. Then they can have other things. So they can have very small stature. So they are very cute and short. And no matter how much they are eating, they are not growing well. Then they have these brain conditions, different kinds. So they can have intellectual disability, which means they're not learning properly. They can be very forgetful, memory issues. They can have attention issues, hyperactivity issues, all the brain things. Then they can have abnormalities even of the limb. So a shorter limb or a limb one is bigger than all sorts of abnormalities. Then they can have the organs in the body, the heart, the kidneys, every aspect can also be affected, the liver. The other thing I didn't mention, when the mom has been really drinking and is an addict, when the children are born initially, they have an alcohol withdrawal when they are born, first day. So it's as if an addict with alcohol who doesn't get alcohol, the way they become very jittery, sweating and everything. The babies come out having the same thing because when they're in the womb, they are used to the alcohol coming to the mom's blood. Yes. So once they get out and they don't get the alcohol, they are very jittery. In the baby nursery, you see these children crying. They have a very shrill cry compared to other babies.
Regular babies.
Yes, and they are very shaky, like that. And their systems can go up and down. Their blood pressure can go, their blood sugars can go haywire just because they are going through this withdrawal. So then we have to treat them like a baby who is in withdrawal, alcohol withdrawal. They can even have seizures, convulsions. Yes.
It's quite interesting. I would like you to advise our listeners and those who may at one point in searching for this topic stumble on this video. What would be your advice to them?
Okay, so my advice is that, as I said in the beginning, this is one of the few conditions you can prevent. So as a woman, if you are in a stable relationship and there can be a child out of this, you should not be drinking. If you already have a drinking problem and you want to have children, then you should seek help so that you can get help and support to stop drinking before. If for some reason you were drinking and you find out that you are pregnant, as soon as you find out, you need to stop totally. Because as I said, not all women who drink will have it. But the more you drink, the worse or the higher your probability. So as soon as you find out you're pregnant, make sure you are not drinking and you are not doing other things also. And if unfortunately you do have a child, you can relate that these features I've talked about. You can relate to the fact that maybe my child may have fetal alcohol syndrome because of their behavior, their learning, their development. Then seek help. Just go and see your doctor. Say that I suspect this. Let them go through it and see, and then start giving you support as a family.
Indeed. Now we understand that the fetal alcohol syndrome is not hereditary. It's man-made.
No. Yes.
And it's
acquired.
totally avoidable.
Yes.
I am forced to ask this because you mentioned as soon as one realizes that she's pregnant, she can stop drinking and the baby may be normal. What about stopping this drinking, say 3 months to conception? Is that still safe?
Before or
conception.
After?
No, before conception.
That is better. That is even better. That's stopping. If you know you're going to get pregnant,
Mm-hmm.
then you keep your body clean as possible. Yes. So stopping before pregnancy is better because the effects could be on day one of conception. The day the egg meets the sperm, if you have alcohol in your system, it could happen. So better to stop rather before the conception than later.
Well, I hope our African mothers have heard, sometimes it's very typical, Nigeria, Ghana, Liberia, the Anglophone West Africa, the moment the woman is pregnant, even in the course of pregnancy, she still requests for, let me have a stout, let me have a beer.
Yeah.
The baby needs this to step down to cool,
Yes.
all of these things. But I'm glad
Yes.
you have really taken your time to break this down for us. And we say thank you so much for all of these. And we hope that, we'll continue to be telling our people more and more about all of these conditions so we can have a better society. Thank you so much, Dr. Marylin Mabell Wilson, a neurodevelopmental pediatrician, a medical director, and CEO of Mission Pediatrics Accra, Ghana. We will see you in Ghana very soon. Thank you so much for your time.
Thank you too. All right.
Goodbye.
Bye.